There's carrot stretches and then there's carrot stretches. Most people think carrot stretches are simply about bending the neck, but these two versions are doing something very different mechanically. On the left, the horse is mostly just swinging and rotating the neck towards the tree. On the right, the entire body is organising around the movement, and that difference matters far more than the stretch itself. And here it is from the side. Watch the horse on the left. The neck is being pulled around very quickly, but the movement stays mostly isolated to the neck itself. There's twisting, rotating, and very little organisation through the rest of the body. Now compare that to the horse on the right. The movement is slower, more organised, and the body starts to organise around the flexion rather than simply swinging the neck sideways. If the focus is solely on moving the neck and not on how that is being done by the horse or what's going on in the rest of the body, at best the stretch is not beneficial, and at worst you're actually enhancing the compensation patterns that the horse already has. We can see that the neck is actually completely twisting and the vertebrae are rotating rather than staying stacked and aligned. And we can also see that the weight distribution through the forelimbs is not correct, and the horse is dumping a load of stress through the right side of the ribcage because that is actually obvious more so on the right hand side. When we compare the second version, the neck is remaining stacked, the thoracic sling is lifting, and the ribcage comes to centre before the stretch is actually asked for. The stretch level is reduced because what we don't want is the horse dropping in the base of neck and then twisting and rotating through the neck vertebrae to achieve a stretch that is not one that is beneficial to a riding horse. So we focus on just aligning the neck, stacking the vertebrae and flexing the pole rather than laterally overbending the neck and causing the vertebrae to become misaligned and other compensations within the body.